So this is going to be somewhat of a, I think it's a moderate explanation, but you might get shorts on this. So this is going to be about randomized control trials, because I feel like this is something that is, like a very strong foundation to any kind of implementation of a project, whatever, Right. So what is a randomized control trial? And before that, I think it's best to understand that scientific research evidence, right? So there is actually a pyramid that goes from bottom up, and you will see that it works from initially use the observational studies and then the experimental studies, and then finally comes your clinical appraisal. So let's you look at the lower down bottom one. The lowest would be somewhere around some of these case reports. So you have the evidence from what real things. So because there's just a narrative, so this comes lower down, followed by the observational studies, which you will see as a case series, uh, cohort studies, then case control. Yeah, specific case. Just selected those specific case and their procedure. So these are observational studies. Then if you go beyond that, what we have is the experimental studies, which is what we are talking about, randomized control trial and non-randomized. So both of these type of studies comes to the next level, which is, so if you go from below, going higher from observational studies, you're coming to the experimental studies. So now you add the experimental studies, okay, right. So if you want to go beyond this, now this is it's an appraisal if you go on beyond this. So here what you have is something where you collect a lot of these studies, and you try to come up with an evaluation of what is right and what is wrong and what is actually happening. So a summary of a lot of numerous studies. So that is either a systematic review or a meta-analysis. So this can shape policies and guidelines, and so sometimes even those evaluations also come over there. So this is basically your scientific evidence, your structure. This is like a pyramid that goes from down up. The number as you go up decreases, but now, because due to automation, a lot of advancement in technologies, and use easier software. There's AI also that's coming also a lot into this field. So we can see that these things are becoming much easier to evaluate. So you will see a lot of systematic reviews, meta-analysis, coming into play, and keeping us up to date on a regular basis. So that is your evidence. Now what I want to mainly talk about is the randomized control trial, and what is actually happening, what are the things that's being highlighted here, what are the types maybe in the randomization technique in each of these components, and also the steps. So this is what I'm trying to get through in this. So this is just an outline of what I will be going through. So just to be starting, so if we have a randomized control trial, so this is an experimental study design, as I told you from that evidence chart itself. So now it's an experimental study design. Now what is it, right? So it is experimental study design that focuses on evaluating the effectiveness. So you want to evaluate, so you have an intervention, so evaluating the effectiveness of an intervention, right, in contrast to a control group under minimal bias. So this is actually, you are taking all of the components and you are summarizing it in the one statement. That's basically a definition. So you don't need to memorize anything. So it is what you so it is an experimental, because I told you from that diagram, it's an experimental study design. Then now what you're doing is you are having an intervention which you want to assess based on some literature review, or based on some your personal experience from your work, and now you are looking at that, claiming that it is doing something, causing some kind of an outcome. So you want to prove that this is the thing. So you have an intervention, that is your intervention, right? So whatever you are thinking might help, right? So that's your intervention. And yeah, so you are checking that intervention. So you have two groups. One, the intervention group, where it's receiving this issue, receiving the treatment, and then you have a control group. So both of these are being compared, right? They can be compared at different points, different ways. That's a different thing. But this different thing in the sense, there are different types of that. So okay, so comparison between the intervention and control group under minimal bias. So there are ways you can reduce the bias. There are different types of bias. So we will see that too. Right. So now we have talked about the basic things, and some of the components. We have already talked about the intervention, the control which is present, the intervention that is also there. In addition to that, what we have is something called as a blinding aspect, randomization, and analysis. And then after that, we'll just get to the types. So now, like I said, we are doing this to release the bias. There are different types of bias, right? So if you want to talk about the types of bias, so one of them is like, you can start sometimes when you're making the biases, anything that can alter the process, the initial or the process, or this entire study. causing some altered results, right? From if you are now one of the person who is doing the study, or one of the person who is a healthcare professional who is treating a patient, so you might be having some kind of a selection bias when you're selecting the patient. Let's say you're an investigator, you might have some kind of a bias, right? You're saying, I know, I feel like this patient might contribute more. So sometimes you might have a tendency to select one patient because you might because it might contribute to something. Then is the same way you see this bias. There's also at the end observer bias. So selection at the end is the observer bias, whereas you might prefer a certain outcome. So in the end, because of your preference towards the outcome, now you are going to be selecting something not actual. Not actual means not realist, not the real value outcome, right? So that is an observer bias. Another thing is there might be other factors, right? For example, a patient who's a caffeine user, he might have smoking as a something else. So that is a stimulant activity, isn't it? Right. So if you are looking to find correlation between caffeine and maybe heart disease, then this person might be having smoking as the background factor. Then now how are you going to understand that? So that is again confounding. So there's confounding bias. Then sometimes you might lose patients in follow-up attrition bias, because they might not necessarily prefer that treatment, so they might lose follow-up. So that is another form of bias. So there are different types of bias, right? And that's what you're trying to minimize by this randomization and blinding process, right? So that is what we are going to be just talking about, just a small insight into that. It's not a deep one, but so now let's think about blinding, right? So now let's say we talked about blinding. So this is not you doing everything with closed eyes. What it means is you can be blinded on 4 different levels. So this some of you might say, well, what are the four? There's only two people here, so then how are we getting four people? So now this is where it gets interesting, right? So one is if you're looking at some health class scenario, like there's a patient and there is a healthcare professional. So the ones who are being blinded is the patient. First one, with this one blinded trial, is the patient is already blinded, double blind. The healthcare professional who is also treating this patient is also blind. So it's a double blinded trial. Both of them do not know what is happening. I mean, they know what I mean, what's maybe the modality or whatever is going on, but who and who in which groups, that's something they are not really familiar with because they are blinded. Another thing, third one will be the investigator itself is blinded, meaning he also doesn't know, like he's just randomly putting it here and here, trying to do it. That's another form of blind. The final blinding is the statistician doesn't know which and which group. So this might require some statistical expertise to actually know how this is going to happen. But the concept is that from patient to healthcare professional, then from the investigator, and then all the way to the statistician are blinded, right? Sometimes, so you might want to separate all of these categories so that you can actually perform something of this level. Because sometimes healthcare professional is someone uh, who is involved in the investigation, who is like doing the investigation. He's also treating the patient, and also if he has statistical skills, he's also doing the statistical evaluation. That's probably the common current circumstance. So that is something uh, that's the quadruple blinded, right? So double, so one blind, double blind, triple blind, and quadruple blind. So these are the definitions for that. Now come to the randomization. So what this means is the different randomization techniques. So it just means how you can take a sample, how can you randomize it in a way so that it is, there's no pattern, right? So certain things might are not even if you randomize, even though they are a type of, the classification say it's randomization, it's not completely random. Now with that said, let's get to the types of randomization that we can apply to here. So first and foremost is the commonest, what do you say, it's the simple random sampling. So that's straightforward, very straightforward, right? So how can you do this? Well, probably you can use a random number generator or some kind of there's sometimes a table, a random number table, where you can close your eyes and something randomly have someone select some one number, right? So that is one way, or maybe a lottery. So this way you can do a simple random selection. So usually serial numbers might be given to your individuals who are being treated, and in that sense, the patient who is falling under the serial number might be selected. That's one of the ways you can do this, right? The stratified random sampling. So this is now you are getting these groups. There are many different groups, like age, gender. So there are different groups, right? So you are randomly selecting individuals from any one of these groups, any one of these specific groups, right? And they are, you're selecting these groups. They are what you say, uh, a proportion. They're maintaining the proportion. So what I mean is, like, you're not directly selecting from this, because there's no these are different parameters, no. So what I mean is, so you have age, you have gender. So you have, maybe there's a, maybe for your circumstance you're getting like 60% male, 40% female, something like that. So you might, oh, there's a different, more elderly people are in the study, so you might want to get your correlation or your samples to be a representative of the population. That's the main purpose of a sample. So you are stratifying your random samples. The next one is a systematic sampling. So that is means, like, you get your serial numbers and you organize everything, and you start your, like, everything is selected. This the systematic interval. So the systematic interval is something you may be getting from random, right? So you might even, maybe you are even planning that, right? So, and you might select the initial one to be random, and from that you are going in an nth number. So like every 5, every 8, so something like that. So this is systematic. So, and sometimes this is sometimes considered to be not that random, because once your initial one may be random, but everything else follows a specific pattern. So there's some, there's, so it's usually they say it's not true random. All right, it's not true random. Then another one is, you can be separated in something known as block sampling, block random sampling. So you can be divided into like blocks. Like, say there are 4, you're selecting a block that is of 4 individuals, and then there can be like 2A, 2B, and then you can arrange that in any way, like A, B, B, or A, B, A, B, like that. And then you are getting these individuals based on that random, block pattern that you are getting. So that is block randomization. Now, others would include like random clusters. So again, cluster and cluster random sampling. So you have different districts. So sometimes you might select a district based on a cluster. So that is cluster random sampling. Another one, the final one that should be mentioned, is basically your adaptive, right? So let's say, for an example, the patient has some kind of malignancy or cancer. Now you want to prefer, it's very, ethical here. Now there comes a real ethical concern, and there's a preference towards the treatment, right? And if you know, some to some theoretical extent also, the treatment is pretty working, then you have to naturally, put more people in that, in the treatment category. So you want certain more individuals in the treatment category, so they are having a malignancy. So, and sometimes it's like wasted sample. Why do you want to to lose an opportunity to learn something, right? So this is also one of the things, but again, from an ethical standpoint, so it's a really, complicated thing. They might have to sign a lot of documents, like really, get the informed consent and what is exactly happening, right? Most of the people who reach out to studies are individuals who have not, what do you say, have tried a lot of various methods, and they have not come to any kind of success. So they try to switch to something else, try to find an alternative, and this is where they find themselves at. So now we have talked about, the randomizations, and now you will finally, I already told you about the biases initially so that you can get an understanding. So now let's just talk about just some few methods. There are some methods I might not know, but just a few, quick insight on what exactly are, basic methods. So generally, in the sense, if you're comparing drug A to drug B, so what you have is something like a parallel randomized control trial. So one is having your intervention, other one is not having your intervention. Another one is where you can have both your intervention running together. So it is something like a factorial one, factorial RCT. Another one, you run your intervention on the same patient. That is like a crossover. So these three are the ones, I am able to remember because those make sense. But in addition to that, there are some other, variants like pragmatic as well as some cluster, right? So those are some of the other examples, but we will stick. These are the things you can have reference to. Just keep in mind. Now come to the thing is, now you want to put some kind of a randomized control trial into motion. So how are you going to do that? What are the steps in a randomized control trial? So now initially as any steps, first you have to identify the problems. This is what any kind of research is focused on, right? So you go through literature review. So you're doing going through some articles, or you're going through some real world problems that you have reflected upon, and you're creating a problem, right? You're creating a question. You're not creating a problem, you're creating a question, right? So you are creating the question. So it has to fall come towards that the pico. There's a term, there's a mnemonic that looks at how your research question should be, and it's pico, meaning the population, the intervention, control, and the outcome that you are expected to see. So your normal your research question or statement should have that pico in it, right? So you can say I am on focusing on osteoarthritic individuals. Intervention may be this. What is the control? Maybe standard therapy, and outcome you want to see the range of motion or some quality of life, right? So that may be one of your research questions. So you can get a question like that, put up a research question based on your literature. Now you need to know about these things, right? So you need to know what about your intervention. That's how you come up with some of these things, right? You can't just come up with maybes. No, you have to have an understanding, like, okay, so this is something that is happening, so we want to implement it. So you have done this and you have formulated your initial question. So now it's time to set up a protocol. Right? You want to do something now, so you have to put some kind of a proposal or a protocol, and this will have certain things that you have to. So you will have your general objectives, right? So you want to do something. So general objective and a specific objective that contribute towards that, right? So if it is something like you are testing some kind of drug and you're testing the effectiveness, so you might have to um, so what is it? Testing the drug. So first you have to identify the individual. So your specific domain is to identify the individuals with osteoarthritis. Maybe they're grading, right? So grading. Then you might have the quality of life in individuals who had among the control group, the quality of life among the ones with the intervention, to compare the effectiveness or the difference in, so to those things, to measure the effectiveness or difference in quality of life score. So those type of things that build towards your ultimate general objective. So the specific objective that come towards general objective. Right. So just it's like contributes towards that, right? So it's not that complex, but that's what happens. Right. So generally your objectives, so you after finishing your objectives, you have to, I mean, if you look at your proposal, there is a specific order for that, right? So that is an order you have to, it's a general, it's a research paper order. So you have to stick to that, right? Otherwise it's going to be difficult for anyone to evaluate, what you're doing. So now in the sense, but there is an order to it, right? It feels like there is an order. All right. So you have done your objectives. Now you have to also put about what you are actually doing. What is your study design? So it's what is yours is a randomized control trial. You can say it's experimental study design based at this institution covering this population. What is the sample size? What is the duration? So these things have to be addressed, and also some ethical concerns have to be addressed here. So with that, now you have something that can be given, right? Now come to so after this, it has to go to the ethical review board, which authorizes or certifies, okay, this is ethically okay, and you had to also get permission from the institution to perform this. So now when everything is okay, now you can proceed with the uh, investigation, the study. So now you're doing the study. Right, now you have to select the individuals who are going to be part of your study, meaning you have to have a strict inclusion exclusion criteria. That is also you will be mentioning in your methodology of your proposal, so the protocol. So but just for the sake of telling people, say that now I want to select based on the protocol, based on the criteria that is set forward in the protocol itself, right? Okay. So that is, and so now you have got your inclusions. You have taken collected your in people. right? So you have your intervention group, control group. So now you want to set the things in motion. You set the intervention in motion based on your type of randomized control trial, which we talked about. There are, the different types. So now you have, yeah. So now you started this. Now you want to reduce the bias as these things are also going on. So you are doing the blinding procedure, right? So double blind, or usually double blind, but you can go for one blind, double blind, triple blind, or the other one that's based on for the higher levels of blind. You might need more statistical expertise to actually see how you can deal with it. So once you have started the research, now it's pretty straightforward. You have to follow these individuals. Again, I forgot to mention about the questionnaire. The questionnaire will be there, in your methodology. You have to have an outset of what you're looking at. The outcomes. Sometimes you might have to have a document which documents all of this, right? The findings. So that is one thing, and you will have that. So in order to get the outcomes, you follow up the patient. So you will get your outcomes. Once you have the outcomes, it's about analyzing the outcomes, interpreting them, and finally publishing them for the scientific community to evaluate. And sometimes it has to be peer reviewed, right? They have to, go through a editorial process, a review process, and then it comes to final publication. And publication also, sometimes you might revise it later on based on, if you are doing some kind of a secondary thing, or you are not completely finished, you feel like there's some additional data which you can work with. So there are things that you can do even after the research, that is called a revision, right? So those are the things, as far as try to make it as simple as possible. I think I made it like in a very logical sense for you to understand, because I do not feel the need to really put any kind of map, because in the end it's just you doing research and incorporating important parameters. So if there's an order in your mind, then I don't think you can get things mixed up. It's in the end you just have to start and end, right? So keep that in mind, and usually it covers all these things.